This is the Best Health Podcast, brought to you by Atrium Health.
Good day, everyone. Welcome back to the latest Atrium Health podcast, brought to you by Atrium Health and Atrium Health Wake Forest Baptist. Hope you are doing well and have been staying safe and healthy out there. We have a great guest joining us today. As you all probably know, there are different health-related awareness months that happen throughout the year, and May is no different. May focuses on a couple of different specialties within health awareness, and one of the more recognizable ones is Stroke Awareness Month. There's extra emphasis during the month of May just to let the public and community know about what's going on with stroke care and stroke awareness and prevention and all that good information. With that being said, we have Dr. Stephanie McNeill join us for today's podcast. So I want to welcome you, Dr. McNeill. How are you doing?
I'm great. Thank you for having me.
Of
I hope
course.
You're doing well too.
Yes, ma'am, I am. I know you're very busy with patients, so appreciate you taking time to chat with us and chat with members of the community who are listening and provide some good nuggets of info that they can take with them to help hopefully reduce the risk of stroke or help recognize a stroke that might be affecting a friend or family member that they can seek help with. So before we dive into the stroke specific content, Dr. McNeill, it'd be great if you could just tell us a little bit about yourself and a little background and how long you've been at Atrium Health.
Yeah, so I'm from Charleston, South Carolina, born and lived there most of my life. Went to high school and college in Charleston, but I went to the Citadel, just to be clear.
Okay.
And then I went to medical school at the MUSC in Charleston.
Sure.
Completed residency there in neurology, and then went to the University of Alabama at Birmingham for my stroke fellowship. And I've been at Atrium now for almost 3 years.
That's awesome. Charleston is one of my favorite cities to visit in the whole world. I love Charleston. I love food, and Charleston has a lot of great food. So.
We have a lot of good food there, yeah.
Oh my goodness. Love it. And that's great that you graduated from the Citadel. That's fantastic. I appreciate you sharing a little bit about yourself, and I want to get into some of the stroke questions I have for you and get your feedback on some of them. The first one I want to start out with is maybe just talk to us a little bit about what specific stroke services and expertise and specialization that we have at Atrium Health, how that helps patients who are coming in to get treatment from us.
Yeah, so at Atrium Health, we have a large variety of members, not just neurologists, who are usually the ones who take care of acute strokes, determining what type of stroke it is and what type of treatment we'll provide. It even starts before that. EMS is trained in recognizing strokes. The emergency medicine team is very important part of help recognizing strokes and recognizing if patients are a candidate for stroke treatment. They'll call the neurology team. We'll evaluate people immediately, either in person or via computer, virtually. We have a team of telestroke nurses who cover some of our hospitals, who help aid in the care so that we can see more patients, and they help me see more patients, by helping coordinate things so that we can be more efficient. We also have radiologists who are trained in neurology and stroke, who will help identify some things. I think most of the neurologists read their own images, but the radiologists are always great at finding, extra things to help us with the care. And then once we determine if a patient is a candidate for stroke treatment, there's two different types. We have the stroke medicine that the neurologist will help with, a medicine called TPA. And some people aren't a candidate for the stroke medicine, but they may be a candidate for intervention with someone who does procedures and surgeries. And At Atrium, we have our neurosurgeons who do that. We also have interventional radiologists who can do these endovascular treatment that I tell patients they're stroke surgeries to help remove some of the clots out of the brain. And then even after our patients are admitted, we have critical care available. We have our nurses trained in neurology and stroke as well. We have stroke navigators to help patients transition and their families, patients and their families transition in the hospital and out the hospital, all the way to our rehab team once our patients have left the hospital. And then we also see them in clinic as well. We try to get all our stroke patients in stroke clinic at least once so that we can help coordinate care once they leave the hospital. So it's a large team, multiple members of the team, and everyone does their part to try to help address stroke care.
I think some of the latest advancements, they're just incredible with on the medication side, but also on the surgical side. You know, I had a family member a couple of years ago, right before COVID started, actually, that she had a stroke and you know, was rushed to the hospital. And it's just amazing how quickly, you know, a patient can get in and start receiving care and in a thrombectomy or other types of procedures to remove the clot, and just it just night and day, or 180 degrees, how quickly the patient improves in some cases. And you know, I think that's not uncommon to probably have a family member at some point, for anyone listening, might suffer a stroke or suspected stroke. And I think that's one of the reasons we're chatting today, is just to raise awareness about what they can do. With that being said, I just wanted to maybe set a little bit of a foundation and ask you, what are some of the major signs and symptoms of a stroke?
Yeah, so there's several different signs and symptoms. We like to use the acronym BFAST. I usually tell patients, when you're having a stroke, it's important to be fast and get to the hospital as soon as you can. And this acronym, I usually write it down for them, or we have printed cards. The B in BFAST stands for balance or dizziness. If all of a sudden this happens, it could be a stroke. So we recommend seeking evaluation. E, eye symptoms, so trouble seeing out of one eye or both eyes, that can be a sign of a stroke. The next one people are more familiar with, F and BFAST, is facial droop. We usually tell people to smile, and if one side of your face doesn't move as much as the other side, if it's droopy, that can be a sign of a stroke. A is for arm weakness. So we have friends or family members raise both arms. And if one arm falls or isn't able to stay elevated, that can be a sign of a stroke. And with that being said, it's not just the arm, it's also the leg. If one leg is weaker than the other, that can be a sign of stroke. S is for speech changes. And so, you know, I tell people, if you can't understand what someone else is saying, or they can't understand you, that can be a sign of stroke. If you ask someone to, you know, some simple questions that they should know, you ask them to repeat a question and it's not making sense, or it's very difficult to understand, very slurred and muffled, that can be concerning for stroke. And then T in BFAST is time. And that's a time to call 911. I always recommend everyone call 911 because not every hospital is a stroke capable hospital. And when you call 911, EMS is notified that this is a stroke, and they take you to the closest hospital where you can be evaluated for stroke. Those are the most common signs of stroke, but we have some other signs if you want to talk about those.
Well, I think that acronym is great for people just to tuck in the back of their mind. Be fast. If everyone listening, and if you don't take anything away, just remember the Be Fast acronym for balance, eyes, face, arm, speech, and time. And you know, that's an interesting point you bring up about the EMS being aware of, you know, the proper facilities to transport a patient for suspected stroke. And you know, I think that speaks to Atrium Health is a comprehensive stroke center, correct? Which is one of the highest levels of certification institution can receive, if I'm not mistaken, right?
Yes, it is.
So that's I think a vote of confidence. People are seeking treatment within Atrium Health, that it is a certified comprehensive stroke center, which is great. So we mentioned if we start seeing one or more of these symptoms in the BFAST acronym, you said, probably the most important thing to do is call 911. And I think some people, have never called 911 before. They've never had to, or they might, for some reason, be a little apprehensive about, quote unquote, bothering the emergency system. You would probably say that they should not worry about that and call 911 as soon as they can, right?
Yes, that's correct. We tell people to call 911 as soon as you notice the symptoms. In training, we're taught you can lose up to 2 million brain cells per minute when you're having a stroke.
Oh,
And
wow.
so the longer we wait, the more, likely damage could be irreversible.
Yeah.
And we also have treatment for stroke. The medicine for stroke, we try to give it within the first 3 hours, sometimes a little bit longer than that. But, if you make it within the first 3 hours, for sure, you're a candidate for the treatment. And so I often don't like for people to wait. I've had people say, oh, my arm was numb and weak, and I thought it was just falling asleep. So I took a nap and I woke up and now I can't move my whole side of my body. And,
Oh, wow.
it's important to take these things seriously because, by the time you wake up for a nap, it may be too late to get any treatment, and then any acute treatment. And then we'll have to work on the other half of stroke, which is the rehab and recovery half.
I guess better safe than sorry, right? You would like to have someone come in and maybe think they're having a stroke, and you be able to give them the news that, possibly they're not. It might be something else, as opposed to the other way around, where they waited too long and maybe they were putting it off or thought it was something else, and it was indeed a stroke. So I think that those are all great points, Dr. McNeill. I appreciate that. And that's very interesting. Up to 2 million brain cells a minute. I think that just speaks to the critical nature of getting help as soon as possible. That's very interesting. Kind of related to that, as we're talking about stroke and stroke care, I think one thing that I need to ask you is, and I guess maybe almost every topic is kind of in the light of COVID and the pandemic that we've been going through for the last couple years. And, I think that stroke care in light of COVID and kind of where we are, and we see numbers ebbing and flowing with case numbers going up and going down and going up and going down. Talk to us a little bit about what you've seen as far as stroke care during COVID and, maybe the impact of care or people avoiding care in some cases around COVID. I think that would be interesting for listeners.
Yeah, so I would say stroke care hasn't really changed during COVID. We're still providing the same level of care during the pandemic as we did before. And now when things appear to be improving, our level of care for the most part has not changed. Again, we can still see people virtually, even if they have active COVID infection. I see people virtually whether or not they have it. So, our level of care hasn't changed. I do agree with you. I think that there have been a lot of cases where people did not come to the hospital as soon as, their symptoms started because of, I don't want to go to the hospital. That's where the patients with, coronavirus are. I don't want to get COVID. And we have seen people delay their care and maybe put themselves outside of the eligibility to receive treatment because of the delay. And, I'll say that we do a really good job of trying to reduce any contamination. We're still there. We still want to protect all brains from stroke. And I always try to tell people, let me take care of your brain. And we have plenty of people on staff who can help prevent, the spread of COVID. And I think we did a really good job of that during the pandemic and, without changing our methods of treatment.
I'm glad you brought that up. That's really interesting, that the neuro experts and the comprehensive staff for stroke care is still there, still doing your job day in and day out. The entire system, healthcare system at Atrium Health, lots of people that are taking extraordinary measures to keep staff and patients safe in light of COVID. So I appreciate that kind of reassurance that you're giving in your comments. I think that's important for community members and potential patients to hear. So I appreciate that. I did want to talk about a little bit more. I know you touched on that earlier, Dr. McNeill, and maybe want to dive a little bit deeper. Obviously, there's many strokes that happen not only in our area, but across the country each year. And I think you touched on the comprehensive and sometimes intensive care that people can receive after they've suffered a stroke, and kind of how you lead people through that continuum of recovery. If you want to just dive a little bit deeper into that, I think people might find that information very helpful.
Once someone comes in the hospital for stroke, the thing that we're doing in the hospital is trying to figure out the cause of their stroke. So we do a number of tests to try to figure out what happened and how to prevent any new strokes in the future.
Okay.
So that's probably the first thing that we do. As soon as it's determined to be safe, we have our therapists evaluate all patients with stroke for the potential for recovery, stroke rehab and recovery. It includes the physical therapist for ambulation, walking, mobility, the occupational therapist for use of your hands in everyday life.
Okay.
And then our speech therapist will also help with not only speaking and diction and how clear you sound, but also with swallowing. I also often tell people you can be weak on one half of your body and weak on one half of your throat. And so we have to have, our speech therapist come in to assess, is it safe to swallow, or will food go down the wrong pipe and cause complications, things like that. I usually tell all my patients, my job is to make sure you're medically stable and to prevent any new stroke and get you to rehab as soon as possible. And there's different levels of rehab. Usually our therapists determine what type of rehab our patients qualify for. My job is to try to get everyone to acute rehab. I tell people it's the rehab hospital. It's like a boot camp where you get lots of activity and lots of recovery for whatever deficits you have. And unfortunately, I'm usually not a part of that side once you leave the hospital. Our team, the physiatrist, PM&R and rehab, physical medicine and rehab, they are the team that really is in the rehab hospitals along with the therapists. And they do such a great job so that when we see patients in clinic, we also have a stroke survivor group. We'll see our patients there and how much they've recovered from when we first saw them in the hospital to, months later when they are walking back into the support group to show us how well they did. I think that's always very rewarding because we don't, we're doing our job on the acute side, but when you see someone recovers, it's actually very motivating to keep doing the good work.
Yeah, I can imagine how rewarding that would be. As we get close to wrapping up here, we're talking with Dr. Stephanie McNeill with Atrium Health during Stroke Awareness Month, and she's offering lots of good information about strokes and the type of care people can receive. I'm sure that her and her colleagues would love not to see you in the first place for having a stroke. And to that point, Dr. McNeill, if you can share maybe some good tidbits of ways to reduce our risk of having stroke in the first place.
You're absolutely right. Most often, by the time I see patients, they've already had a stroke. So we're doing secondary stroke prevention, preventing any new strokes. But the same things that we do for secondary stroke prevention are some of the same things you would do with your primary care. And we call that primary stroke prevention. So the number one cause of stroke is high blood pressure, hypertension. So, just controlling your blood pressures in conjunction with your primary care provider is probably the best way to reduce your stroke risk. Other things that I'm often telling people and families are about controlling blood sugars with diabetes, watching your cholesterol, diet, exercise is always important. Smoking of all kinds is not good for your vessels, and it does increase your risk of stroke. And even some other things that we wouldn't think about, like some things like sleep apnea, certain systemic conditions, even some people have abnormal heart rhythms that can cause stroke. And so most often, even if we see people who've had a stroke, Once we've addressed their cause, we send patients back to their primary care provider so that we can prevent any new strokes. And I always joke with my patients, I'm like, I need you to help put me out of business. I don't want anyone to have a stroke. Put me out of business and take care of all of these risk factors, not only for yourself, but with your family. And we have some really good primary care providers who are doing the work, but it takes, it's just as much effort from our patients. And, stroke is a big motivator, but how about motivate everyone before having a stroke so that they don't have to see me? That would be
absolutely.
Yeah.
Yes, that is a great way to put it. Well, Dr. McNeill, we appreciate you so much taking your time and talking with us today about stroke awareness and stroke prevention. This has been great information.
Thank you so much.
Absolutely. As we wrap up, I just want to let people know that you can get more information about all kinds of care, including stroke care, at atriumhealth.org. If you have questions or if you want to contact a provider and get more information, you can just go to our website and that information will be available to you. As we wrap up, if you found any of this information useful, please share this podcast with your family and friends. We want as many people to be aware of these prevention tactics and care tactics as possible. As we wrap up, one last plug for the BFAST acronym. I want everyone to put that in the back of their mind. Thanks to Dr. McNeill for sharing that. Until we talk again, I hope everyone continues to be well.
You've been listening to the Best Health Podcast, brought to you by Atrium Health.